On today's The Doctor Is In, we are discussing tuberculosis. Just yesterday it was announced that another Andrew Jackson High School student has tested positive for the respiratory disease. Dr. Scott Ackerman is here with the details on TB and what parents need to know to keep their children healthy. Dr. Ackerman, thanks for coming and talking about this on something that's very topical. That you haven't heard that much of in the news, and then all of a sudden now we're hearing a lot of it, and it's tuberculosis. So let's just kind of back up and talk about what exactly that is first. What does it mean?
Thank you for having me today to talk about tuberculosis. It's really, we've heard about it this past week, and it's something you don't hear about a whole lot. So what tuberculosis is, it's a bacterial infection that's found in the lungs. It starts in the lungs, and it's a very serious bacterial infection because it can spread to other parts of the body. It can go through the bloodstream and cause lots of problems, even death. It's an old bacteria. It's been around for centuries. We have found it in mummies from Egypt. When these mummies were examined, we found traces of TB or tuberculosis in these mummies. The bacteria is called Mycobacterium tuberculosis. And again, it can be a very life-threatening bacteria.
Is it common in the United States? I mean, we don't hear of it happening all that often, so how common is it across the country? So
tuberculosis is pretty rare in the United States. It happens about 10,000 cases a year. It was once very widespread, but in the 50s, with the advancement and development of antibiotics, it was virtually completely wiped out. But occasionally it resurfaces, typically in those people who live in close contact with each other, who might be immunosuppressed some way, people in nursing homes, in homeless shelters, in schools, and things like that.
So you say people who are living in close proximity, then how does it spread? Is this something that if you touch something that someone had tuberculosis, then you would pick it up that way?
Right, so it typically is spread because it's transmitted through the air. So someone who has tuberculosis coughs or sneezes, it gets in the air, and that bacteria then is inhaled and it goes into your lungs. And so recently at Andrew Jackson High School, we postulate that maybe that happened, that someone came into school and had some tuberculosis. But most people who are exposed to TB show no symptoms. The bacteria goes into your body, it lives in your body in an inactive state, and then if sometime in the future when your immune system gets weakened for whatever reason, the tuberculosis can flare up and symptoms will be present.
So what are those symptoms then? If some are exhibiting in some people, what are they and what should we be on the lookout for?
So the symptoms are like any other lung infection, but more severe. Cough, shortness of breath, fatigue. But what makes tuberculosis different in the symptoms, frequently it's associated with some night sweats, with fever, with chest heaviness, pain in the chest, and most importantly, blood, coughing up blood. So when we see a patient who's having a cough and they're bringing up blood, we typically think of two diagnoses: cancer or tuberculosis. So tuberculosis really mimics cancer there. And when I see a patient, the patient I see with lung cancer, when they're first evaluated, tuberculosis isn't the differential diagnosis because they have the coughing up of blood.
So then if you find that someone has tuberculosis, how is it then treated? How do you diagnose it, and then how is it treated?
So if you are in close contact with someone who's had TB, or you have these symptoms you think might be tuberculosis, see your doctor and you should be tested for TB. In fact, people like me, healthcare workers and so nurses and physicians and people who work in nursing homes, homeless shelters, they should be tested on a regular basis because I could be, I'm not, but I could be harboring tuberculosis. But I was tested just recently.
Okay.
And the test is a very simple test, it's the PPD test. So you may have remembered it when you were a kid, you had to get it to go to school. And what happens is they inject the antigen of tuberculosis just under the skin, make a little bit of a welt there. And then it's watched. We look at it 3 days later. And if the area becomes red and inflamed, then you know that you've been exposed to tuberculosis, and so you should be evaluated and treated for it because you may have the inactive state of it in your lungs, and you don't want, God forbid, for your immune system to be suppressed and then that flare up. So you're treated for it even though it's not in the active state. You can be treated for it and it can be eradicated, and also prevents you from spreading it to others. Because if it's left in there, it could be threatening, it could be life-ththreatening.
Well, that was going to be my next question. Yeah, I mean, how serious is this? I mean, if we find that we have this, or we know of someone who has it, I mean, how dangerous can it be to our health if ultimately left untreated?
Right, if it's left untreated, When it flares up, if you don't recognize it, that it's tuberculosis, there are a significant number of patients that die of tuberculosis. So it is serious.
So if you come in close proximity to someone, or let's say, you know, the students at Andrew Jackson High School, I mean, should you be getting tested even if you don't exhibit the symptoms, or is that just...
I don't know what they're doing at Andrew Jackson High School, but I would suspect they're probably testing all the kids. They're probably doing the TB test on all the kids. So if you suspect that you're going to be around people, like if you're working in a hospital or those sort of places, you should get tested.
All right. Dr. Ackerman, thank you as always for being here. We appreciate you coming on every Friday. And thank you for all of the valuable advice and for sponsoring this segment. For questions regarding today's topic and any other health question that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.